This is Dr. Maryam Lustberg from the Ohio State Comprehensive Cancer Center, and I wanted to highlight today the HER2 CLIMB study, which showed impressive results in patients with metastatic HER2-positive disease. But instead of focusing on the clinical outcomes, which have been covered in great detail, we like to focus on the toxicities experienced on patients on the study. So tucatinib is a HER2 oral targeted therapy, and one of its most common toxicities is actually diarrhea. Even though grade 3 diarrhea events were reportedly low in the FIT clinical trial population, when you actually even look at the clinical trial data, up to 80% of patients had some type of diarrhea, and up to close to a third of patients actually had grade 2 diarrhea, which, if you think about it, these patients are staying on these therapies for months, if not years, and the burden of some of these toxicities that maybe, as we're reviewing these studies and saying, well, the grade 1 and grade 2 events are quite low, you can imagine that kind of the burden can build up over time. This is particularly impactful for patients who are older. We know, based on previously published studies, that the cumulative burden of grade 1 and 2 toxicities can actually lead to early discontinuation in the real world when patients are experiencing this cumulative burden. So I think my take-home message is to really look at our patient-reported outcomes as these new drugs enter the market. I think we'll have to see how they perform in the real world setting, when maybe perhaps less fit patients are experiencing these drugs, and really working together to research innovative ways where we can optimize symptom management as well as quality of life, while we are focusing also on anti-tumor efficacy.